tables of 8 again without too much social distance. We're still going through some Good morning, I guess. What an exciting day. We have in-person attendance. We have a robust audience in our virtual format, Zoom, so welcome everyone. My name is Mayra Pineda, President and CEO of the Hispanic Chamber of Commerce of Louisiana, and on behalf of our Board of Directors, it is my pleasure to welcome you to our 2021 Healthcare Technology and Innovation Summit. Let me restate that. Our third annual Healthcare Technology and Innovation Summit, which we're very proud of. HCCL has been diligently working to educate and erase significant barriers that have systematically impacted our communities. COVID-19 further highlighted these gaps, resulting in a disproportionate effect throughout the nation. Our goal today is to continue to bring awareness to the important healthcare issues our community faces and to educate around leveraging the latest technology and innovation, which has allowed early detection, treatment, and helps to transform medical systems and patient-physician relationships, providing faster, more effective, and less costly solutions for diseases. I know you agree, investing in health for economic development is the right thing to do. Health impacts economic growth in a number of ways, like less absenteeism, increased production, and improved morale. We must continue to bridge the health disparities affecting Hispanics and other minorities, like language access, lack of insurance, cultural beliefs, and socioeconomic factors, including immigration status. I would like to thank all of our sponsors for your leadership on this important topic, and to our esteemed speakers, thank you for sharing your insight and expertise. And now, it is my pleasure to welcome Mr. Eric T. Jones, Regional Director, External Affairs for AT&T, for some remarks. Eric?
First, I'd like to thank Mara and the entire Hispanic Chamber of Commerce Louisiana team for putting on today's Healthcare, Technology, and Innovation Summit. I'd also like to take the opportunity to thank all the first responders and medical professionals that kept us running during the COVID-19 pandemic. AT&T supports first responders, medical professionals, and we serve those who serve others. Again, thank you for your service. AT&T supports first responders, medical professionals, and stays committed to serving those who serve others. AT&T's essential workers restore connectivity at homes, businesses, and hospitals where doctors and nurses rely on communication to save lives and to receive the latest updates and developments in this fight against the COVID-19 virus and new strands that may develop. It's our FirstNet network, which is the nation's first cellular ecosystem designed to support healthcare workers, first responders, and medical workers. AT&T is also committed to advancing education, strengthening communities, and improving lives through the civic initiatives. AT&T has a long history of investing in projects that support learning opportunities, promote academic and economic achievement, and addresses public health needs. AT&T has invested in our Louisiana communications network, our people, and our local communities for over 140 years. In addition to enhancing and expanding our network, our team continues to work to strengthen our communities by supporting organizations like the Hispanic Chamber of Commerce of Louisiana that are helping build better futures for its members and enriching the Louisiana business environment as a whole. On behalf of Sonia Perez, President, Southeastern States, David Arbery, Vice President, AT&T Louisiana, and the over 3,000 employees, and I say again, the over 3,000 critical, essential employees that keep Louisiana running, thank you for this opportunity.
Thank you, Eric. And now it's my honor to introduce our keynote speaker, Mr. Michael Del Aguila, who was born in Peru and raised in Peru, Ecuador, and Guatemala before moving to the United States for higher education. He received his PhD in epidemiology from the University of Washington and has over 20 years experience in health services research. This includes 15 plus years in the biopharmaceutical and device industry and more than a decade in managed care and consulting. He has led multidisciplinary research teams to explore the health and economic impact of new technologies and medications across large populations in multiple therapeutic areas. Having lived in 4 countries and 7 states across the United States, Michael has a great appreciation for the challenges and benefits in delivering healthcare solutions that are culturally and socially tailored to healthcare needs of different segments of society. Dr. Del Aguila joined GRAIL last year as head of real-world evidence in population health sciences. Among other activities, this function leads efforts at GRAIL to ensure our research has broad representation from all populations. To do so, we actively pursue collaborations with external partners to conduct applied research to address health equity challenges, particularly in underrepresented minority populations and those with less access to health care. These relationships will inform and guide our research and development and ensure that our technologies have the broadest impact on detecting cancer early when it can be cured. So, with you right now, virtually, this is the benefit of our new world, Dr. Michael Del Aguila. Michael?
Thank you very much, Maida. And I hope you all can hear me okay. It's a pleasure to be here, and I appreciate the opportunity to speak to the HCCL on this important topic with regard to multi-cancer early detection. I am unable to see the slides, so if there is any way of making sure that you can move on to the, I assume the title slide is up, is that correct? Thank you very much, that's great. And if we can advance to the next slide, and then the following. What I'd like to do is take a couple of minutes to talk with you a little bit about GRAIL, the organization that we have, and the test that we have been bringing to market called Gallery, which again relates to multi-cancer early detection, and we think can really afford us with a unique opportunity to advance healthcare delivery to multiple populations that have challenges receiving all of that. So GRAIL was founded back in 2016 and is located in Silicon Valley, and we have a pretty unique grouping of teams that are scientists, clinicians, software engineers, and other experts with regard to oncology that have really worked to advance the science that we have here. And our mission, as you heard it earlier, if we move to the next slide, is simply to detect cancer when it can be cured. So, talking about the need that we have with regard to all of that, I think all of us can appreciate the economic and the real humanistic toll that cancer takes with regard to all of us and people who we know and love. It can be measured in terms of years of life lost. It can be looked at an annual cost expenditure associated with that in terms of the actual treatment, and then the overall economic burden. And either way you slice it, it is really pretty overwhelming when you think about what can be done there. But we know, as we move to the next slide, that if we're able to target cancers earlier, in other words, before they have metastasized while they're still localized, the 5-year mortality rate is considerably better than afterwards. So if you look at all cancers, 89% of people will have a 5-year mortality or 5-year survival when diagnosed earlier, compared to only 21% when it's diagnosed late. If you look at a specific cancer such as lung cancer, that translates to being 56%, and this lung cancer being one of the highest killers associated with mortality from oncology in the United States, 56% survival rate if it's diagnosed early versus 5% after it has already metastasized. If we move to the next slide, we can talk about what happens currently, because we have 5 screening tests right now that can only take, that would be looking at breast and cervical, colorectal, lung, and prostate cancers. And so the deaths that are associated with those cancers for which we have approved screening modalities right now is really only 39%. 71% of the deaths within the United States are in cancers for which there is no actual screening test available at this point in time. And so obviously there is a need for us to be able to address all of that. And if we were to take a look in the populations that may be of interest to the participants at this Congress here on the next slide, we can see that there is a real disparity with regard to late-stage diagnosis and mortality in key segments of the population that may be considered underrepresented in terms of treatment and screening. So African Americans have the highest mortality rate of any racial or ethnic group for all cancers combined, and most major cancers. Similarly, Hispanic and Latino patient populations are more likely to be diagnosed with advanced stages of disease, and Native Americans, Native Hawaiians, and Pacific Islanders are 30% more likely to be diagnosed with cancers compared to non-Hispanic whites. So clearly, within these populations of interest for us, there is a real need to be able to screen and treat for these cancers. Returning to some of the ideas that Maida was expressing earlier, we know that COVID has also injected an additional challenge with regard to cancer screening and then, of course, detection for all of this. And so what we're looking at right now is, if you were to look at mammograms and pap smears and colonoscopies, across all of them, there's been a pretty substantive decrease because of either access to care and the availability of getting to that, or an unwillingness to participate in normal screening activities. So we have several burdens that are in place for us. And at the same time, looking at the next slide, they're all the time saying that we need to have a more resilient healthcare system that can put in the idea that we have to learn the lesson from COVID-19 to have an opportunity to reevaluate and reconfigure the strategies by directing the resources that we have to ways that we can do that. And as we move into what GRIL offers for all of this, we think that there is an opportunity to really make a dramatic difference and take advantage of both the technology that we have and that we offer in terms of the screen that we have, and the need that's there with regard to what patients are experiencing now and their ability to get access to the system as well. So if we move from the need and the tremendous challenges that are available there, let me just spend a little bit of time talking about what GRIL's technology does and how we go about doing this. So if we move to the next slide, to put it in relatively straightforward and simple terms, I'm sorry, if we could back up a little bit. I didn't spend time on this slide here. The root of what we do in our test here is to understand that the tumors, as they are in the body, are releasing cell-free DNA into the blood system, and that this can be measured. There can be an analysis of this as it circulates in the blood to identify, first and foremost, whether there is cancer in the body. And then, because of the specific sequencing approach that we use, we can actually detect where the type of cancer is that these tumors are releasing the cell-free DNA. So we have the signal that comes from the tumor and compare that with the signal from the normal blood, and we're able to identify not only that there is cancer, but also what is the cancer signal of origin in looking at all of this. Now, if we go down to the next slide associated with that, then what this means is that we're able to provide 2 answers to clinicians as they take a look at this blood test. First and foremost, that there is the signal of cancer that's there, and secondly, that it is actually being able to have the tumor and the type of tumor that it is that we can identify for that. So if we think of the test that we've identified here on the next slide, what we're assuming that this will do is complement the current screening modalities that are out there. Our test will identify, as I will talk about on the next slide, identify a number of cancers that are available. But at this point in time, this is intended merely to complement and supplement the actual current screening activities that are underway there. Because we offer an ability to detect a greater number of cancers that are there, our expectation is that this will optimize overall cancer detection above and beyond those 5 for which the current screens exist right now. And because it's done through a blood draw, the expectation is that in contrast with some of the other screening modalities that are currently out there, whether it be a mammogram or a colonoscopy or pap smear, the minimized harm to patients with regard to doing this will be an added benefit for their screening and cancer care treatment. So how does this test perform, actually, if you take a look at that? Let's move to the next slide, and we can understand some of the characteristics associated with this. There's a lot of information on this slide, but I want to take a couple of minutes to just point out some of the key features that are worth knowing about this test that we offer from GRAIL. First and foremost, we have over 50 cancers that are identified, if you look on the right there, and many of those, as we mentioned before, that are currently not screened. So the unscreened cancer would be, for example, anorectal or liver bile duct, lymphoid neoplasms, testicular, thyroid, uterine, some of those cancers that are there, and then currently in addition to the breast, cervical, colorectal, lung, and prostate, as I mentioned before. The positive predictive value, looking on the left side here, is one of the screening test measures that is very important to understand how beneficial this is. If you do have a positive test there, what is the likelihood that you're going to be having the cancer that's being detected? And for example, right now, we know that in mammograms, the positive predictive value is about 4%. If you contrast that with what we have here, the positive predictive value for the Galleri test that we have, based on the clinical studies that we've done, that's at 43%. And at the same time, it minimizes the risk of having a false positive rate. Less than 1% really of those patients that have a positive rate will it be false. The other test performance measures that we often look at, sensitivity and specificity, and types of ways that we're looking at that, and the accuracy of the organ prediction are also fairly high here. So in other words, 50% of those patients, close to 50% of those with a positive test from Galleri will actually go on to have a diagnosis of cancer. And the benefit of looking at that, if you take a look at the next slide that we're talking about here, is the total cancer detection rate then could increase over threefold or about threefold when it's added to these recommended single cancer screenings. So if we can pass to the next slide, and you can see what's looking at the currently existing types of screens that are out there, whether it be stool-based or mammography. If we look at all 5 of the single cancer screens in one, you can see that if you look at adding the tests that we have with regard to the positive predictive value and the sensitivity for all of that, the total cancer detection will really increase compared to what's currently underway right now. And we think that this really has the potential to dramatically change the scope of screening, cancer detection, and then ultimately, of course, treatment associated with that. And the treatment associated with that and the benefit from doing that can be highlighted on the next slide as we move to that. If we go back to thinking about the benefit associated with early detection versus late detection, you can see the modeling that we have done to the addition of Galleri to our standard US screens, looking at the stage of diagnosis, and then of course the mortality associated with all of that, shows a dramatic increase in survival through the identification of these patients in earlier stages of disease. And adding it to the 5 US recommended screenings could, and according to our models, potentially avert 100,000 deaths annually based on the existing mortality rates by stage of diagnosis and localization of the tumor for all of that. So clearly, across the United States, we have a tremendous need to be able to improve our technology and the way that we diagnose cancers, and we believe that we have the methodology to be able to do that. The final thing that I would leave you here before we talk about sort of the meat and application to this population that we're talking through here is the clinical development program that we have. And if we look at the next slide associated with that, you can see the 4 different studies that we've undertaken here with regard to our technology. So we have CCGA, which was a circulating cell-free genome atlas, where we validated our technology looking at the tests that we have. And then we've had a couple of prospective and observational studies even to understand how does this perform in various different specific subtypes of cancer, and those that are then looking at from the clinical perspective, the clinician perspective, how does this test perform? All told, we've enrolled and studied about 145,000, close to 150,000 patients over the course of time in looking at this, and feel like we're really developing a robust study base on which to both improve the analytics that we're doing and then also introduce this into clinical practice. But the slide I want to spend the last time on here, if we could, this final slide here, is to really talk about the future of how we're looking at this with regard to what we intend to do right now. So we candidly acknowledge that our studies to date have not had as broad representation of all of the populations and the subtypes of patients that we would think could benefit from this technology. So we want to really make sure that first and foremost there is a broad awareness of this test that's out there and engage diverse stakeholders who can work with us to help us provide their insights in working with these populations and give us the scientific rigor that we need to establish studies to develop our technology in these populations and hopefully have meaningful partnerships that will last over time to not only talk about the introduction of these screening tests, but also the treatment associated with them and extend the benefit of this to patients that are really could potentially benefit from what we have here at Grail. So we believe that the technology is available there. We recognize that there is tremendous need in understanding the populations and working with community organizations that can help us move these into those communities, and then ultimately collect the data to follow up and understand the long-term meaningful impact that this can have for them. So again, thank you for the opportunity to speak here. I know that there is an intention to have a little bit of question and answer, and I'd be happy to respond to any questions that people would have.
Zoom platform, so any questions there will be directed to you. But Dr., I don't know if the audience has any questions at this time. Please. Did you hear that?
I'm sorry, no, I was not able to hear the question.
We had Peggy Mendoza from Mendoza Medical Group, and your first question was? Yes, the accessibility of the test, and the second part of the question is, will the test be covered by Medicare, Medicaid, et cetera?
Those are great questions. So as I mentioned, at this point in time, we are in the early stages, the early days of launching this commercially right now. And the coverage for these tests is variably performed by different payers around the country, but our expectation and our goals are to get to the point where these would be considered as part of the screening paradigm for cancers that providers would be able to offer patients and that would be reimbursed by insurers. We are gaining experience, again, just because it has been recently launched. We are gaining experience with all of that, and it does seem to be incorporated as part of the early signs and symptoms that can be used with insurers to secure reimbursement for the diagnostic workups that would follow the positive signal detected by a Galleri test. I do want to emphasize the point that I was making earlier, that at this point in time, we view this test as being a complement to current cancer screening guidelines. So it's not on the U.S. Preventive Services Task Force regimen yet. We anticipate that it would likely get there at some point in the future as the appropriate evidence comes in and the justification for doing this. But at this point in time, there has been some experience and success with working this through, understanding that this could be considered part of the signs and symptoms associated with the need for further diagnostic workup.
Thank you. Anybody else? Anselmo?
Good morning. Gracias, Dr. Del Aguila. Thank you for being with us. My question, you mentioned in your presentation the gap of discrepancies on survival rate for different communities for the versus the R-large for cancer survival. in your expertise, is that differentiation, that gap, is supported by socioeconomic differentiators, or is it due to biological traits? Is there some data that support or help us understand what the differences are?
Thank you very much. That's a great question. The short answer to all of that, and it may be somewhat unsatisfying to say it this way, is that it's likely that we don't yet have enough information to definitively say. On the basis of what is currently understood, the likely explanation for the discrepancies in both diagnosis, and survival is related more to socioeconomic rather than race, ethnicity, and genetic underlying factors. And it relates to both the access to care, the discrepancies in the care that is provided, a simple way of misunderstanding what the patient needs are for all of that. And so the majority of that is likely to be to some of those more, as I said, socio-demographic characteristics. However, that is not to dismiss or undercut the real impact that racial differences may have in doing something like that. And we need to continue to study those and understand them a little bit better and begin to tease out what is due to the administration or the access of care as opposed to the underlying genetic and racial predispositions for both being diagnosed with cancer and then ultimately the outcomes associated with it.
Thank you, Doctor. And now, thank you very much for those amazing remarks, and we hope to welcome you in person next year to continue this conversation. In the meantime, thank you for your time, for great support of our event, and we look forward to seeing you soon. And
thank you very much.
Thank you. Now we have a message from Blue Cross and Blue Shield of Louisiana. And we welcome our next panel as well.
Blue Cross is proud to be a supporter of the Hispanic Chamber of Louisiana and proud to sponsor the 2021 Healthcare, Technology, and Innovation Summit. At Blue Cross, our mission is to improve the health and lives of the people of Louisiana, and we do that by partnering with community groups across our state, groups like the Hispanic Chamber to meet particular needs of people throughout Louisiana. The Hispanic Chamber has been a really important strategic partner for us over many years, and that's been even more so and even more evident in these last number of months relative to COVID-19. You all have been an incredible partner as we work together to raise awareness in the effectiveness, the safety, and the availability of COVID-19 vaccines. You all have worked with us to create Spanish language materials to address specific concerns that we hear from Hispanic Louisianians. We've worked together to make sure that everybody has the facts and can have access to the vaccine, particularly so since we know that Hispanic and other minority residents of our state are at higher risk of dying or having severe complications from COVID-19. We've worked together to create content in Spanish, including flyers, radio clips, video messages, social media messages, to make sure that folks know how they can get access to the vaccine. Two specific things we worked on are addressing cost concerns and transportation challenges. In our shared outreach, we've worked together to put out messages in both English and Spanish to make sure folks know that COVID-19 vaccines are covered under the CARES Act. There should be no out-of-pocket cost, and no one should hesitate getting the vaccine out of cost concerns. On the transportation front, residents statewide can dial 211 and schedule rides. If they have a barrier to transportation, if they may have an issue and not have a car, certainly we want that to not be a barrier to folks in our state. Most recently, we partnered together with Ochsner Health to have a in Spanish Facebook Live event. This allowed individuals to ask questions in Spanish or in English relative to the COVID-19 vaccine. To get those questions answered, we are very proud of this event. It's the first of its kind for us, and you can check that out on our Facebook page or YouTube channel. We know that the Chamber is doing so as well. We wish you all incredible success with today's event. We know that equitable access to technology and to innovation has always been important, and it's even more so in these times that we live in. As digital health, as digital access becomes so much more an important part of our lives, we know that whether it is low-speed internet connectivity or lack of literacy on internet or technology, are just not entirely feeling comfortable, can all be barriers for why people might not tap into critical tools, and that can impact outcomes. We think that those tools need to be available equitably and thoughtfully across the state of Louisiana. We are excited to partner with you all to make that a reality, and certainly we look forward to partnering with you all in the months and years to come in other ways that we can to meet the needs of communities across our state.
Hello, I am Anselmo Rodriguez. I'm the Manager of Supply Chain Management at Blue Cross Blue Shield of Louisiana. I'm here to support the Hispanic Chamber of Commerce in their Healthcare and Technology Innovation Summit. This event that happens every year is a great avenue to share technologies and knowledge about the healthcare in Louisiana. Our relationship with the Hispanic Chamber of Commerce of Louisiana has been for many years of the most important as we leverage each other's networks to help the Hispanic community to bring value in the supply chain side, in the community relation effort, and to bring a better healthcare for all Louisianans, to support our mission. We would like to congratulate the Chamber in this event, as always, doing a great job for the people of Louisiana, and gracias a la Cámara por apoyarnos hoy y siempre en avanzar la misión de Blue Cross Blue Shield of Louisiana, de avanzar la salud del todo y la vida de los residentes de Louisiana.
Good? Yes. All right, great. Well, great message from our sponsor. Couldn't agree more. Healthcare is so important for our economic wealth and well-being of our community at large. And we're going to talk about this today in our healthcare panel. I'm your moderator for this panel, Alejandra Guzman. I worked as an executive director for LSU Health Foundation for New Business Ventures. We're an affiliate organization of LSU Health. And today we have incredible panelists that will speak to a lot of what's been going on in our current context. And you know, we all know COVID has changed our lives personally, also the way we work and the way we see our healthcare system as well. So we're going to talk a little bit about that. But we're going to go beyond COVID as well and talk about how technology and innovation plays a critical role in our healthcare system today. And I'd like to welcome our panelists. We've got Dr. Jennifer Abegno, Director of New Orleans Health Department, Dr. Jennifer Zielinski at East Jefferson Hospital. Thank you for being here today. And at the state level, we got Teresa Soko from the Louisiana Office of Public Health. So we got a very interesting mix. We're going to see our issues seen from the state level, a local level, and also from a healthcare institution managing the current context and also making good use of innovation and technology. So please give them an applause and welcome them. So Jennifer, why don't we start with an introduction on what you're doing currently at East Jeff, and perhaps give us your perspective on technology and how technology and innovation is helping and driving the healthcare system today.
Of course. So I am a colon and rectal surgeon, but I'm also chief of staff at East Jefferson Hospital. And things have definitely been changing. We just were bought by LCMC, and so we're part of the LCMC family. And it really couldn't have come in a better time. We struggled to do more with less recently, and I think that really forced our medical staff to kind of embrace the evidence-based medicine to really provide higher quality care. LCMC is very encouraging and promotes physicians to come up with their own ideas for how can we make technology better for our patients. And we just recently had a physician planning session, and several of them were about telemedicine. Telemedicine, you know, we kind of were forced to do that recently, and I think it's here to stay, and I think it's a wonderful thing, but it can be done better. There are several ideas out there where we're going to connect the patient with the physician on more than just a face-to-face level. We're going to have vital signs, we're going to have labs, blood sugars, oxygen saturations, all those things that we can collect over the phone in a secure manner so that it gives the whole well-rounded picture for the patient. But to do that, especially in Jefferson Parish, our community is aging, and we need a good customer support system, and a lot of these are really focusing on that. But one of the first questions it was asked by Teresa Lawrence, one of our new board members at East Jefferson. She said, well, how is this going to communicate in a multilingual standpoint? Is that going to be available? And everyone kind of scratched their heads, and so that's another thing that we really need to incorporate, because if we're not all successful as a community, every demographic, every culture, then it's not a success. And so that's what we're really trying to focus on at East Jefferson.
Great, and I love this as a segue to bring it over to the state level, and obviously after at the municipal level, we need to address healthcare disparities. In the particular COVID context, what is the state suggesting on how to address this with our communities of color and Hispanic communities as well?
Can you hear me? Okay, good. So, I always say that as much devastation as has been brought by the COVID pandemic, one of the more positive aspects of the pandemic has been really the highlighting of the health disparities that have long existed, but have really been brought to the forefront of everyone's attention. And so I'll say that what we're doing is we're evaluating specifically cases as well as deaths in the context of race and ethnicity. We're actually intending to be able to take a deeper dive. Now that we are seeing lower levels of transmission, we're able to do sort of more robust data analysis. And so we actually have the plans to hire 2 new data and analysts that are really specifically focused on health disparities analysis, so that we can provide really an in-depth report about what we've seen across really all of the COVID indicators. We're interested in the differences not just among the infections and the deaths, but testing practices as well, because that's an important indicator of access to health care. So it's something that's become a really important focus for the health department, and I think that over time we'll be able to continue to reporting more and better and more comprehensive data related to that.
Yep. Jennifer, do you want to address it from a municipal level?
Sure, and I think I can maybe sort of marry what our other 2 panelists were talking about. I think what COVID has shown us locally and also likely at the state level is that there is need for high tech and high touch. We all in the healthcare space have come to embrace telehealth and different methods of doing things electronically that, as an emergency physician, I never thought I would do because we're so in person, but that have really been transformative. But the problem with that in our city in particular is that when you have 30% or so of individuals who lack reliable internet, then they're excluded from all of these wonderful innovations, and in many cases those are the individuals who have the worst health access and outcomes to begin with. So we recognize this very quickly that for us, the pandemic was not going to be defeated if we only looked at high-tech messaging and delivery of services. And so that's one of the reasons why we set up the first community-based testing in the country, really, where we went deliberately into neighborhoods that were chosen because we knew they didn't have the same access to telehealth and other services, and did significant outreach to get residents' trust to come there. One of the things that did for us, particularly in the Hispanic community, is allow us very early on, really earlier than a lot of other places, to understand that the burden of the pandemic was far greater from our Hispanic residents for a number of different reasons, and to understand that these were also the residents that in many cases were being completely left out of accessing healthcare, of accessing information. And so being able to interface directly with residents, but then using technology internally, thanks to our partners at the state, who allowed us to see what was happening at the neighborhood level and at the levels of not only race but ethnicity. I don't know if this room knows how that wasn't being done elsewhere in the country. They were white, black, and other. And that is a complete disservice. That's how much of the pandemic got missed early on, particularly in the Hispanic community. But because LDH was looking for it, and because they shared the data with us, and then we were using technology internally to really pinpoint where we needed to go. That's how I hope we're able to provide a more robust response. And, just as you both said, it doesn't stop here. Now that we know what we're capable of in terms of marrying the technology and the hands-on approach, that's going to inform everything we do.
Yeah, so you make a great point, meeting people where they are and offering the tools and systems that speak to them and offer those access points. It was very successful in New Orleans, as you indicated, and I think that's a great lesson to think, where do we go now? So I'd love to hear your all's opinion on how do we leverage what we learned through this experience, very rough experience that forced us to rethink our systems, and how do we use data and technology, as you all mentioned, to move forward. So I'd love to hear your opinion, and if you want, Jennifer, we can start with you to see what you're observing at East Jeff, and perhaps it's not something that is fully baked, but it's in the talks and something that we can expect to see in the future.
So what I would like to see at this time, and I don't want to say that we're in a lull, but the most of the pandemic we have under control, is now is the time to get everyone comfortable with this technology. Patients of different cultures may not be comfortable even speaking face to face, so we need to really work on that. And there's a lot of learning that we have to do, especially our older patients. We need to get them comfortable with this technology, because if you don't use it and you don't use it properly, then it's not helpful. And so that's what I would really like to see, is more of a community outreach to make sure that everyone understands what's available to them and how can they use it to the fullest, because it's all about preventative medicine, in my opinion. Not that the ER is not great, but if we can keep patients out of the ER and can handle most of that stuff at home, that would be a blessing.
Now, from a public's perspective, how can there be collaboration from the public side and also with specific private systems so we can facilitate that process of connecting with communities?
Right, so what I'll say, one of the really important pieces that has been missing during this pandemic, and Dr. Avegno sort of highlighted it, and I certainly appreciate that she recognizes the work that LDH has done to try to achieve as great a level of completeness with regard to race and ethnicity data as possible. It has been a real challenge. And the reason that it has been a real challenge is that a lot of healthcare facilities either don't submit the data to us or don't collect the data to us. And that is particularly true with regard to ethnicity. There are large healthcare systems out there that do not even collect that piece of information, and so they're not able to send it to us. And I'll tell you, one of the current efforts where we really want to be able to have good data related to both race and ethnicity is related to vaccination efforts, because we want to make sure the vaccine is available to all groups, and we want to be able to see where there are inequities with regard to uptake of the vaccine, so that we can really make efforts to try to improve that. And so I would really do two things. I would encourage healthcare providers and healthcare facilities to really make that extra effort to ensure those data are collected. And then I would also encourage individuals to really think about when they are asked, because what we really don't want is for a healthcare provider or a vaccine administrator to assume a person's race or ethnicity. We want them to ask, and for that individual to be able to report how they identify. And those are the data that we want to collect. And so we want folks to understand that when we're asking for this data, when their healthcare provider are asking for these data, it's really because we want to ensure health equity. And so to feel comfortable being able to provide that information so that we can use it to ensure that these healthcare services are equitably provided.
I think I want to go back to something that you had. Certainly, I agree with both of my colleagues, but I think it's time. I think the pandemic has shown us what many of us were working towards before, that health is wealth, and physical health and the economic health of a community are inexplicably, or are completely intertwined, and you get double bang for your buck when you invest in one of them. And what we learned in the pandemic is that to communities that controlled the virus, whether it was a local community here in the States, whether it was a country or some other municipality, those are the ones who recovered more quickly economically. And as business owners, I think that the case was very real when businesses had paid sick leave and policies that allowed for employees to stay home. The virus didn't spread, and that business was able to successfully operate more easily. We're still seeing that today. So when we invest in the health of our workforce, and both individual and community health, then we're able to see bigger economic gains. And really, for those of us in public health, this is what we call the social determinants of health. What determines whether or not I'm going to live to a ripe old age, whether or not I'm going to get cancer and need one of the screening tests that we heard about, is only about 20% based on who I am, what my genetic makeup is, my anatomy, my physiology. The rest is a series of factors totally outside biology. It's what neighborhood I grew up in, what the streets are like, whether I was exposed to violent crime, what my education level was, what the income inequality in my community is, what kind of job I'm supposed to have. All of that can negatively impact my health, which then in turn negatively impacts my ability to participate in a thriving economy and be a productive employee. So it was rocky at first. I think public health and business interests were really portrayed as being completely at odds. But if you sort of followed this through the pandemic, you heard this chorus of economists echoing what health professionals were saying, that we can't separate the two. And so just in the recent months, I think we've had that awareness. As we reopened, several of our hospitality businesses came to us and said, oh, we can really market New Orleans as being safe. That is helping us attract business to the city. And these might have been folks that might not have been real happy with me early on. We should be doing that in other health outcomes. We should be doing that for cancer, for diabetes, for all the things that we see, what you see at the end, because we know that together we can solve both problems.
Well, that was a powerful comment right there, and it can give to a lot of discussions within. I absolutely agree. There's an intersection between economy and the health of our community, and if one of them fails, the other one is affected. What can we do next? As businesses, part of our audiences are either part of corporates or business owners, and I think one of the biggest lessons, as you very eloquently mentioned, is our awareness that we need to keep our employee base healthy to continue to operate our business. I personally think that a lot of that needs to be addressed through preventative health, and we do that through policies, but also offering ways in which people can not only have the time off to take care of themselves, but also have access to that preventative health that they need to keep themselves healthy and their families healthy. Are there any best practices being observed in the world that we can adopt as businesses and policymakers to be able to conquer that?
I see you. I think that's a great comment. And I think it comes down to allowing your patients time to have those screening tests done. I mean, a blood test is great, but the point of a screening test, especially from a colonoscopy standpoint, are to catch the polyps early. And so don't just depend on, blood work and say, well, I checked the box. You really need to follow through with the other screening tests. And I know at East Jefferson, our biggest plan over the next few years is to provide more efficient ways to get these screening tests done, get you in and out as quickly as possible so that we're not keeping you from the rest of your day, the rest of your work. And then same thing from a colonoscopy standpoint, more being able to schedule your test online without having to wait on the phone. And so I think that's where our efforts, part of our efforts are going to be driven, is to make things more efficient so that we're not wasting your time.
So this question allows me to talk about my favorite topic these days, which is, as it relates to COVID, which is vaccination. And so in my opinion, the single most important thing that employers can do right now to protect their businesses, to protect their employees, is to encourage vaccination. I can tell you we've been tracking outbreaks among work sites and other non-congregate living settings throughout the course of the pandemic, and we have seen many outbreaks. I think the total number of outbreaks we've had so far is over 1,000, with over 7,000 outbreak-associated cases. And we have looked a little bit at race and ethnicity with regard to these data. And what we have really seen is in terms of work sites, we've seen the greatest proportion of Hispanic employees that have been infected in industrial settings, in food processing facilities, and also construction settings. And what we have largely found in a lot of these work sites is that even though appropriate mitigation measures may have been in place at the actual site of the work, there was transmission among the employees when they had social interaction. For example, when they carpooled or when they took breaks together, because some of those mitigation measures were relaxed because it's part of the culture, part of the camaraderie, right? And we understand that. The good thing now is that we have effective vaccines that can help prevent this transmission. And it also allows for individuals to relax these mitigation measures. So a fully vaccinated individual now, for example, if they're with other fully vaccinated individuals in a break room, they do not necessarily, as long as it complies with the business, the rules that the business is enacting, they do not necessarily need to wear a mask or to physically distance, because if fully vaccinated individuals are around other fully vaccinated individuals, then they're protected. So it protects the safety and the health of those employees. And in addition, as Dr. Avegno mentioned, we saw a lot of workplaces that had to be shut down temporarily because so many of the employees were either infected or were exposed and had to be quarantined during an outbreak. But if an individual is exposed after they're fully vaccinated now, they no longer have to quarantine. So it really helps the continuity of operations within business places if the employees are fully vaccinated. And I'll be very honest with you, when it comes to innovation, this is not related to technology, but I think perhaps the most important innovation that we can have right now is sort of creative and innovative thinking about how we can encourage vaccination among different groups. And so I would encourage business owners and operators to really get to know their employees, understand if they have questions or concerns, and address those, perhaps utilize folks coming in to address the questions, or incentive programs. I mean, we at the state level, and I know at the local level, are engaging in innovative practices. I never thought I would see a lottery for vaccines, right? And so I think at this point, whatever we can do to encourage vaccination at any level, statewide or in a particular business, is going to really help improve the situation for everybody.
Yeah, I'm just going to echo Teresa's comments and tell you what we're doing at the city. You know, at the city overall, we're about 70% vaccinated. The mayor is very clear in her desire to bring that to 100%. She will not meet with you in her office if you are not vaccinated, which I think is fantastic. But it's not uniform. Just as across New Orleans, we have neighborhoods that are already way above 70%. We have some that are 30 and 40%. And so we're starting to see little outbreaks in those departments that have a low percentage. So, you know, I believe the city may have a reputation at being slow. That's what I've been heard. Imagine if it got that much slower because now half of a department is out, right? And I know that you can all relate to that. And let me take it beyond COVID, right? COVID is our pandemic du jour. There will be other. And if we remember, we didn't have a flu season this year, right? Which was fantastic as an ER doctor and a public health professional. But think back to those flu seasons where everyone in your office at one point in the winter was out for the flu, right? That's another vaccine preventable illness that we've got the vaccine for every year. And then really, you know, we've done a lot of work in the state, and there's other advocates. Just look at your sick leave policies. Look at your paid sick leave policies. 32 states have paid sick leave mandates. Louisiana is unfortunately not one of them. And I think there's this fear that it's going to cost me. But if you look at the long-term savings in terms of absenteeism and that cost to the business, having a few sick days is minimal cost. So the return on investment is there. And I hope that one day as a state we'll get to the point where that can be part of our policy. But there are many businesses, and even now, you know, the benefit of COVID is that hospitality businesses who never thought they could have paid sick leave are looking at it and implementing it. So if it can be done in a hospitality business, it can be done almost anywhere.
Yeah, what an amazing time, right? And I'm going to state the obvious, but we're in the Healthcare Technology and Innovation Summit, and the vaccines themselves are an incredible innovation and use of technology. So we are living in amazing times, and I agree this is the right time to question our policies and see how we move forward. We are running a bit out of time, and we do want to leave 5 minutes for questions from the audience, or also for those that are watching remotely. So if there are any questions, we would love to entertain them.
Any questions from the audience? I'm really thankful to have you. And have you noticed, everyone, what an amazing panel we have? All ladies, all women, powerful women. This was not intentional, by the way. But it just shows the amazing leadership we have in this area as well with women in healthcare. So thank you very much to all of you for your expertise. The Hispanic Chamber is totally supporting. I know, Dr. Avegno, we've been working with that Hispanic task force from the beginning of the pandemic, and we're committed to many with our partners at Ochsner and LCMC as well for vaccination events through the summer. So there's a lot to be done. But I want to, any questions from the audience? I think you answered them all.
Well, oh, there's
there
one.
you go. Okay, let me bring them.
And table number 3. Yeah.
Thank you very much. Amazing opportunity. I have the opportunity and the honor to lead about 100 employees right now. And I have a town hall tomorrow. And as I'm hearing you speak and understanding that we have a good, diverse team, I want to understand, is there anything that I could say to my team to consider vaccination? As healthcare professionals, I'm sure you probably have a different lens that I do in the corporate side. So are there any tips or advice of things that I should say to at least encourage people entertaining the idea for those that at this point still haven't made that decision?
Start.
So, from a data standpoint, what I'll tell you is one of the greatest concerns I have right now, which are variants of the SARS-CoV-2 virus, the virus that causes COVID-19. And this has really been highlighted in media lately, and there's good reason for this, right? Because we're seeing variants emerge that are more transmissible, that can cause more severe disease, and we're concerned that one will emerge that doesn't respond well to the vaccine. And that's going to be an enormous public health concern, right? Right now, the Delta variant that originated in India is a big concern. When it first emerged there, it caused a huge upsurge in cases and hospitalizations and deaths. We're now seeing that variant circulating in huge proportions in the United Kingdom and in Russia, for example, particularly Moscow. And we're seeing upsurges of cases and hospitalizations there. It's about 60% more transmissible than the Alpha or the variant that originated in the United Kingdom, which was already more transmissible than previously circulating strains. And what we know is that when we get one that's more highly transmissible, it outcompetes the others and it becomes the dominant strain, and that's exactly what's happening even here in the United States with the Delta variant. And as you know, what we know, I'll tell you what's happening in the UK, is that the new cases that they're seeing are mostly among those who are in younger age groups. And these are the age groups that have more individuals that are unvaccinated. And this is exactly like what we see, and Dr. Avegno touched on it, with other vaccine-preventable diseases as well. When we have groups or we have pockets of individuals who are not well vaccinated, that is where outbreaks occur, and that is where ongoing transmission happens. And that is a concern for a couple of different reasons, right? One, if we have a well-vaccinated population across the board, even if a new variant emerges that is more highly transmissible, that could potentially outcompete others, it really is going to help us prevent these surges because so many people are going to be protected. But I can also tell you that when people are vaccinated, it prevents new variants from emerging. Because when transmission doesn't occur, then these variants, they can't emerge. And so, you know, what I always say is every infection that is prevented is one less opportunity for one of these variants of concern to emerge. And so for me, that's one of the really the most important reasons to try to encourage vaccination. I know Dr. Avegno has other ideas as well.
Yeah, I would say, you know, it helps to know your audience. Our vaccination rates among seniors are really good. They're over 70%. And so why? Because it was very real to them, right? They either got sick, they knew someone who got sick, they knew their risk and they lined up, right? If you're dealing with younger folks, it's a much different conversation. And what we see is there's a couple of themes of why they might, you know, have not gotten it yet. Number one, I'm young, I'm healthy, nobody that I know got sick, I'm gonna be fine. Well, what Teresa just said about the variants should absolutely scare them, right? Because it scares me and I'm fully vaccinated. Also for our young folks, the myth of infertility is incredibly pervasive. It is a complete and utter falsehood, but it is really destructive. And so there's lots of evidence about the benefits of vaccine for pregnant women and their unborn babies and how incredibly safe that it is. And then really there's the community protection, right? Yes, you're healthy. Yes, you probably won't get sick. But do you have immunocompromised people around you? Do you have elderly people who, even though vaccinated, if they are one of the 5 to 10% who might get it, are at huge risk for the disease? You know, what about them? If not for you, then for them. And then really, if you want to get down to it, you can just ask them, do you like Mardi Gras? Do you like going to Saints games without wearing a mask? Do you like Jazz Fest, right? So whatever appeals to them, there is an answer for.
I agree.
Well, it's all been said. We'll have our panels available if you want a further conversation after the panel. This concludes our session, and we're very grateful for the opportunity to be here today. I hope you enjoyed this conversation as much as I did.
Thank you. Thanks for having us.
Thank you very much.
Thank you very much. Thank you for being here, and we're at your service for anything you need to share. And now we have some messages from our partners with Humana and Verizon.
Hi, everybody. I'm Matt Berger. I'm the president of Humana's Gulf States region, which is Louisiana and Mississippi. Thanks for having me today. We're proud to be long-term supporters of the Hispanic Chamber of Commerce of Louisiana. Like the Hispanic Chamber, Humana is committed to helping Louisianans live our best lives. We're also committed to health equity and caring for a vulnerable population. This became increasingly important during COVID-19. We predominantly do this through two different methods. One is through the social determinants of health, and another is through technology. With social determinants of health, that addresses issues such as social isolation or food insecurity. It's really difficult for the people of Louisiana to be healthy if they have to choose between buying prescription drugs or buying food. Therefore, we've rolled out a number of different initiatives that really help both the community and also a second branch of them that also help our provider partners to help address the social determinants of health. On the community side, some of the things that we've done is we've sponsored and volunteered for organizations such as Glade Waves in New Orleans and Healthy BR in Baton Rouge. What those things do are Glade Waves, for instance, provides free food boxes in underprivileged areas. That way people can have access to good food when they need it. On Healthy BR, they have food pantries in underprivileged areas as well, which enables people to have options for healthy foods when they need food the most. Additionally, we've also rolled out things such as an Acadiana Healthy Food Initiative, where in different parts of Louisiana, we're teaching people to cook food in a healthy manner and also providing them with food through some of our food trucks. Further, we've also have neighborhood centers in various parts of the city, both in New Orleans and Baton Rouge, where members can come in and do things such as exercise classes, which helps combat the social isolation, while at the same time, if they have any questions on their health benefit plans, they can get person-to-person, face-to-face answers to those types of questions. When technology came into play during COVID-19, that became obviously increasingly important as people were staying home more. What we did was partner with some of our providers to gather social determinants of health information, such as food insecurity or social isolation, as those could be good predictors of potential future health issues that people may have. We additionally used technology during the COVID-19 times to increase access to healthcare, both on the PCP side as well as the specialist side. PCP is their primary care physician, as I'm sure many of you all know. And one of the things that we did was roll out expanded access to primary care physicians nationally, but in particular in Louisiana as well. Additionally, on the specialist side, we deployed behavioral health telehealth technology. That way people, if they were having mental challenges due to social isolation and things of that sort, they'd be able to receive on-the-spot mental health support through a behavioral health specialist. So we're going to continue to increase our technology components and continue to support social determinants of health and help improve Louisianians' health as much as we can. We're all in this together as we all live in this great state. So we look forward to continuing the Hispanic Chamber of Commerce coalition with you guys. Thank you.
Working as an EMT in a small town usually means hospitals aren't very close by.
When you have a really traumatic injury, we have a short amount of time to get our patient to the hospital with good results. We call that the golden hour. There's nothing worse than when we're responding to the hospital and the hospital doesn't have the right specialist.
Evaluating patients remotely by an expert is where I think we have a potential to make a difference.
Robots can do a lot in medicine these days, but they can't think. They're still machines. For nuanced decision-making, we still need humans.
We would save a lot of lives if we could bring the doctor to the patient.
Verizon is racing to build the first and most powerful 5G network that will enable breakthrough innovations to take place.
As we get faster and faster wireless connections,
It'll be possible to bring those capabilities to more sites and be able to operate on a patient in a way that was just not possible before.
When you think about underserved areas, you tend to think of remote locations, but the reality is in underserved areas anywhere where the person that you need who has the expertise for the problem that you have is nowhere near you.
Low latency is crucial for things like surgery because the response time has to be immediate, it has to be real.
I could put on VR goggles like these, and when I move my hand, the robot on the other side will mimic the movement with almost no delay.
Who knew a scalpel could work thousands of miles away?
It's going to be life-changing and life-saving.
Good afternoon. There we go. My name is Kelsey Scram. I am the Director of Marketing and Innovation for the Jefferson Parish Economic Development Commission. I am so delighted to be here today to moderate this technology panel and really honored to be sharing the stage with such amazing women who are doing incredible work in this space. Before we get there, I want to set the stage very briefly, tell you a little bit about JEDCO and what we do. We are the Economic Development Commission in Jefferson Parish, so we are here to create jobs, investment, and opportunities in Jefferson in order to develop a more equitable, resilient, and competitive economy. And we do this in a lot of different ways. We do business attraction and retention. We have an abundant supply of resources and tools that we offer to all of our businesses. And we are so fortunate that we have so many local partners who help us do this work, including the Hispanic Chamber of Commerce. Myra serves on our board. She's amazing. We love her. So we are really excited to be able to support this event. We work with a number of industries in Jefferson Parish and at JEDCO, but today I obviously want to talk about two that are at the top of our list for growth and advancement: healthcare innovation and technology, and the intersection between those two. The innovative advancements that are happening here in our community in medtech, in healthcare, and in technology are so important, especially now as we are emerging from this pandemic. The Greater New Orleans area has become a hub for world-class destination healthcare, and that is why we are here today. We are going to talk about all of the really cool things that are happening in our community and how we make that accessible to everybody. Our panelists are doing important work to ensure access to care, increase patient safety, and enhance diversity in their industries. So without further ado, I'm going to introduce you to our panelists, and we'll get started with some questions. So first we have Julie Henry, who is the Chief Operating Officer of Ochsner Digital Medicine. And then we also have Heidi Rains, who is the founder and CEO of Performance Health Partners. So Julie, we're going to start with you. Ochsner is at the forefront of digital healthcare innovation with new tech and digital medicine advancements happening right here in the Greater New Orleans region, which we're so proud of. Can you highlight some of the innovative work that you have overseen in recent years?
Sure. Thanks for having me and giving me the opportunity as well to speak about the great work that Ochsner Health is being a pace setter for in the digital health space. So you might be wondering, what is digital medicine? Well, as we call it, it is the ability for us to pair two things. One is digital devices, namely a Bluetooth-enabled blood pressure cuff, as well as a glucometer, for patients to send readings very frequently to our care teams. So part two of our model is that we have remote patient monitoring for patients with chronic diseases. Again, largely our 20,000 that we have cared for to date, hypertension, which is high blood pressure, as well as type 2 diabetes. We are also expanding the portfolio of our disease states that we are offering within digital medicine. And so today we have two pilots that are live that are working towards proving their value in the same way. And that is for hyperlipidemia, which is high cholesterol, as well as COPD. And so we created these solutions within Ochsner Health with our partners at Innovation Ochsner to really be a solution for ourselves. We have primary care physicians with large panels and specialists managing patients with chronic condition that really needed the ability to go beyond the traditional episodic moment in time care for patients that are suffering with chronic disease, and allows us to really supplement their practice and the outcomes that patients are able to receive by participating in our program. So as patients send us readings a few times a week, those are then incorporated into their electronic medical record, and we drive and apply machine learning and artificial intelligence that personalizes those patients' readings or variations there and alerts our care team. Our care team is proactive as well as responsive to any issues going on with the patient, and really combining and pulling the levers of behavioral and lifestyle change through health coaches, as well as taking that a step further and assigning each individual a clinician, largely a pharmacist, who is trained in therapeutic med management to manage a patient's medications. And all of this rolled together allows our patients to really reach control faster, and even as important is sustain that control. So 80% of patients in both of our programs reach control within 6 months, and then we continue to see benefits from there.
That is incredible, and let's just remind everyone, this is happening in Jefferson Parish, in the greater New Orleans area, that these innovations are taking place. So incredible, incredible. All right, Heidi, you are a healthcare and tech entrepreneur with a history in the healthcare industry. First of all, tell us a little bit about Performance Health Partners, and then if you can share the value of combining healthcare and technology to enhance patient care and access.
Sure. Hi, thanks for having me. Can you hear me? Okay. Performance Health Partners is a healthcare technology company. We're based here in New Orleans. We also have an office in Austin, Texas. Really, our work and our applications are all to support the just culture of care. What is the just culture of care? Well, it's really to improve access, patient safety, the quality of that care, and to support the employees that are delivering that care. So I guess about 5 years ago, we set out to, the whole mission behind this company is to provide technology tools and access to those tools to community healthcare providers. What we were seeing was that this very robust technology suite was available to the larger healthcare and hospital systems, but really it was the small to mid-sized market that didn't have access to this robust suite of tools that would support them in the just culture of care. So we went out to build those. We started with a compliance application, and we've built that into a whole suite. We started with one hospital system here in Louisiana, and we've grown to service healthcare organizations in 24 states and in 15 different sectors of healthcare. So we're not just in acute care hospitals any longer. We're in government agencies. We just won the Department of Health contracts in Alaska and Colorado. Large home health agencies, small home health agencies, nursing homes. Really an interesting vertical that we went into recently is incarcerated healthcare, which is something that is sometimes overlooked. So what we've done is we've increased access to these tools for healthcare providers to achieve just culture of care, not just with the verticals of care, but also in the small to mid-sized market.
That's fantastic. Congratulations on the expansion into new markets. That is wonderful. We obviously need to talk about the pandemic. It has been with us for over a year, and it's something that I think is going to change how we do things in the future. So I'd love to hear how the pandemic changed the work that you've been doing and how it has shaped some of your company and department priorities moving forward. And Heidi, we'll start with you.
What we saw when the world was kind of slowing down with COVID, our company really ramped up. We have tools for infection control, employee health. So if you think about how do we protect the employees that are delivering that care, what we saw was the awareness of the need to adopt technology in the smaller and mid-sized market. That was accelerated. So our company grew 50% during COVID. We expanded into many different states. We kicked up our innovation. We had a very large system in Florida that needed, they're a home health and hospice company, and they had 19,000 employees that were getting deployed, and they were getting deployed into people's homes. And they needed a way to get the information to them, one, to check to see if they potentially had symptoms of COVID, and the second was that they needed to give them access to information about what to look for with their patients and also with themselves. So we quickly, kind of adapted an application we already had, and we would deploy this questionnaire to their employees before the shift. And we were able to identify 5 different employees, which was great. It was a low number, but we were able to identify them prior to them going on the shift and prior to them going into someone's home. So, I think just to summarize, what we saw was the adoption of technology to support our humans that are delivering care that was accelerated because of the COVID pandemic.
And Julie, anything to add?
Yes, where to start? Unfortunately and fortunately, our team, who is remote largely, we have members across 16 states. We are live and can render care and bring access to patients suffering with chronic disease in 35 of the 50 states, here soon to be all 50. But locally within our community, we treat patients in nearly every parish for both hypertension and diabetes. So how did the pandemic change our business? We too saw a tremendous amount of growth out of born necessity. You've probably heard and been educated on that patients with chronic disease were at higher risk too for severe outcomes with the pandemic and the impact that COVID was having on those individuals. And so the time was really right for us to lean in and grow and be able to reach more individuals. In addition to some of the geographic expansion or the distribution channels that we support, a solution to employers, a solution to payers, we leverage the ability from Medicare, federally funded, of course, who covers remote patient monitoring for patients on Medicare. And so we saw that as a very unique opportunity to also go a step beyond and take advantage of federal copayment waivers, where our patients that are Medicare beneficiaries don't even have to pay any sort of, there's no out-of-pocket costs for them to participate in our program. Additionally, we worked with the FCC and secured a $1 million fund grant to go a step further and actually provide the device to patients on Medicare or Medicaid, those in underserved communities that maybe a $40 cost for a patient one time was a barrier to entering our program. And so we've really just tried to work and leverage with governmental, other industries' adoption of remote patient monitoring, albeit it's not a one-to-one, but having to really evolve your model to reach patients that need us most.
Yeah, and I think that's a really good segue into our next question, which is that the Hispanic community, alongside the Black community, have been disproportionately impacted by the COVID-19 pandemic. And we're seeing that these disadvantaged and underserved communities are really in dire need of information and support. So how can technology, medical innovation, digital medicine, as you've mentioned, help provide access to care and access to information in order to serve all of our residents?
So it starts with reach. We modeled our program of what's already in patients' hands. Well, 80% of Americans in the United States have a smartphone. So that's where we start. And it's smartphone brand agnostic, right? You can have an Android device or an Apple device. And so we know, that one in itself, the 20% who might not be able to participate or given, the rural area of broadband access. So we know we can't solve for all those things, although that is part of one of my role is to help with advocacy in the kind of government relations space to increase the footprint for some of those barriers, as well as you've heard from all of our panelists and keynote about social determinants of health. But it is important that we share some additional learning. So I'll turn it over to you.
So one of the things with Just Culture of Care, which is the space that we work in, is not only giving patients safe care and quality care, but we also need to expand the ability for patients and employees to have a voice. And one way that we do that in a Just Culture of Care is incident reporting or reporting of things that they see. So we can equate it to the, if you see something, say something campaigns that we all see for, in subways or airports. But the adoption of that, which has begun, we are adopting that in healthcare, but how do we provide patients access to that? So I'll give you an example. I was talking with the CMO of the CHIP program, one of the managed care providers for the CHIP program, which is the Children's Health Insurance Program. And we were discussing ways to easily get information from their insured or their parents. And one thing that our system does and we're doing is providing that very easy way to get in information. So we were discussing putting access to our software, which is through a QR code on the back of their insurance card so that they could easily report if they saw something, they could say something. And one of the really great wins for our company, but also for the state of Louisiana, because we are in Louisiana, is about a year and a half ago, so pre-COVID, we had the largest technology company in the world seek us out. And they just said, we hear of the innovative things that you're doing. And we went through a grueling procurement process with them, and we ended up on the other side, and we've built their patient safety platform to their needs. And on the back of their badges is access to our system so that any employee can easily report to them. They can just pull their badge, they can use their phone, they can scan the QR code. It's a 1 to 2 minute questionnaire, and that information goes specifically to the team or the department that needs that information. So, part of this is the Just Culture of Care and giving access and a voice to patients and to employees, that when they see something that they'll say something. And part of us as healthcare executives, our responsibility is to receive that information and learn from it in a non-punitive way. Historically, in some occurrences, we may think, well, who is the human that we can point to, that we can, if we kind of fix them or we terminate them, that's how we're going to fix the problem. But Just Culture of Care is not about that. It's looking at the system that supports the humans delivering care, and how do we give them all of the tools they need to achieve that and be successful. And that's really what our company and our applications, that's what we set out to do every day.
Well, you said that, it made me think of not just the role that we're having on the patients and helping them navigate some of the considerations we're discussing, but also the role of the employees. And so one of the things that we've done, not just expanding our clinicians and our care team and our tech support from a geographic perspective, but also does the diversity of our patient population, a third of which, of that 20,000, represented by Hispanic and African American individuals, is matching not only how we deliver care and manage and help them, can't solve for all social determinants of health in addition to their clinical and emotional support needs, but is also, does our workforce match? those individuals that we're caring for. And so one of the things I'm very proud to say, and as an employee of Ochsner Health, as well as my role as the executive over digital medicine, is that a third of our employees match the ethnicity and race of our patients. And we find that very motivating because there's a relatability factor, maybe not a one-to-one, but allowing that trust and that relationship and that accountability really helps us get to the results in terms of the value that the program can provide clinically as well.
That is tremendous. I'd love to hear that. I love to see that this is happening in our community, and you're bringing it, Heidi, to other parts of the country too. Let's talk a little bit about the Greater New Orleans region, because again, as an economic development agency, it's so important for us to be highlighting just how incredible the work is that is happening right here. This region has really set itself up to support med tech and healthcare, and how can we do more of that in the future? And Heidi, I'll kick this over to you first, just kind of since you are really in that tech space, you can highlight some of that.
So our company started in the New Orleans Bio Innovation Center. Actually, I started another company within GNO Inc., which was GNO Think at the time. And the current company, Performance Health Partners, spun out of the other company, and we started in the New Orleans Bio Innovation Center. And really what I thought was special about New Orleans, because I do have investors and I have a board, and some of the, if you know healthcare, you know that Nashville and Brentwood is kind of like the Wall Street of healthcare. So there was a strong pull for me to move the company there, and I kind of dug my heels in and said, no, we're a Louisiana, New Orleans company, we're staying. So with the Bio Innovation Center, it was the support that we found there with the Bio Innovation Center's team, for the innovation team, but also it's the conversations that were happening in the hall. It's the group and the like-minded people that we were sharing these conversations and growing together. So I found that New Orleans had a kind of a solution every step of the way. It started, I started as a one-person company, moved into being, a true, company with employees, and we were in the Bio Innovation Center, and then we graduated from that, and now we're in, a high-rise building here in the CBD, and then we're also downtown Austin. But every step of the way, we've found resources here and got the attention and the support we've needed. It's been great.
And can we talk a little bit about the importance of continuing to innovate and how the region, how some of the business community, economic developers can really help set you guys up for success, and how do we bridge the gap between our community and healthcare? How do we do that? Julie, I'll start with you.
Great. I see that actually, how can Ochsner Digital Medicine help you all? And so whether that is you are responsible for 100 employees, I heard earlier, and struggling with managing their chronic disease, let us be a solution and partner together. There's so many things within Ochsner Digital Medicine, or as well as just Ochsner as a whole, that we can leverage to better support our communities and advance ourselves beyond being 50th rankings on health across the United States.
Anything you want to add, Heidi?
You got it. You covered it.
Perfect. Well, I will end with, I want to talk about diversity, equity, and inclusion. And I know, Julie, that you highlighted this a little bit, but I really want to talk about how we make sure that we are hiring diverse people, how we are helping diverse people, how we are ensuring that we take care of the underserved communities, and how does this translate outward? Can you talk a little bit about that?
Well, you asked when we had a call before this panel, just to tell what is the motivator behind what, why am I doing what we're doing? And I really, would be remiss not sharing with you the reason why I'm very passionate about access to care and inclusion, and that is because I actually grew up without health insurance. I actually, have a health condition now. I'm kind of halfway deaf, but because of the lack of care when I was a child, it was only emergency care. And there's so many of us out there. I mean, my parents worked, but we were part of a gig economy, and healthcare insurance is expensive. So at a very early age, I found access to care in high school by working in a rural health clinic, and was very motivated by this female physician that I worked for, and how she treated, before sliding scales or anything. She created her own method where she would provide care based on a sliding scale to the rural population that I grew up in. And continue on, fast forward through my career, I worked at charity, but I've always held that very close to my heart, that access to care, access to quality care is one of the most important things that we can do in healthcare. And then also giving a voice to be able to report when that care isn't exactly the quality that we think it should be, because that does happen as well. And that has been the motivator behind kind of my work and this company and the applications that we've developed.
That's super inspiring. Thanks for sharing that. Hard to follow that, but as I've shared with you some of our initiatives just in terms of our workforce and motivating patient populations, I just also thought it would be a good opportunity too to highlight I had mentioned that Medicare currently covers remote patient monitoring for patients, but for those in underserved communities that might be on Medicaid, Louisiana Medicaid currently is unable to fund remote patient monitoring just due to competing priorities, budgetary requirements, et cetera, and considerations. And so Ochsner Health felt so strongly about extending Ochsner Digital Medicine in the Medicaid community in Louisiana that we decided to internally subsidize. Now, I'm proud to say, after a year, there are 2,000 members that are enrolled and onboarding in our digital medicine program, and they receive the exact same care as any other insurance, or employer-funded coverage or other arrangement. We render the model in the exact same way. We leverage those grant funds that I had mentioned before to help with the barrier of the initial cost of the device, and there's no cost to our Medicaid populations. That might not be sustainable forever, but what's important is that after this year, our initial findings are just as impactful as our findings in the commercial and the Medicare space, and that is patients getting to control for their chronic disease quickly, sometimes in a period of 90 days to 180 days. The utilization impact of unnecessary emergency room visits or inpatient admissions has declined, and medication adherence has improved. And so we feel so strongly about that. We're doubling down and subsidizing in that way until we can work together with additional payers to really cover this service to serve more communities, particularly in the underserved areas.
Wow. These initiatives are incredible. I know that we are bumping up on time here, so I want to make sure that we have an opportunity, if there's anybody in the audience who has a question for our amazing panelists, please feel free to ask away. It's very quiet. Oh, we have one over at is it table 4 that I see? Yeah, so I would say our solutions are not necessarily like super new and innovative. We're delivering it in a different way, but our mission is really to get it out there and adopt it, right?
Okay, this is when my hearing thing comes in.
So the question is, just for everyone to be able to hear, is what are some of the innovative methods that are coming down the pipe and new things that you're excited about? Was that right?
Yeah, I can take that. So there are about 5,600 hospitals in the country. Okay, there are about 1.5 million points of care and growing. So now every pharmacy is now getting into flu shots and monitoring. So what we're looking at is the adoption of the just culture of care and patient safety and quality of care tools in all of the other points of care other than just acute care hospitals. And so that is what is happening with us, where the just culture of care, patient safety, quality of care tools are getting adopted. All of these healthcare centers are really doing it, but another statistic is that we are relying more on medical assistants, technologists as we expand points of care, we're also needing to expand that workforce. And if we don't have the structure and the scaffolding to have these care providers successful, so that would be checklist. I know in the presentation earlier they talked about asking patients when they're giving their COVID shot. And so we have a lot of applications are about these robust checklists that support these care providers so that they know that they're doing the right thing at the right time. So that's what we're working on.
So in terms of what's next, I'd say as it relates to digital medicine, additional disease states. So behavioral health is one that we're working with our IO team now to curate. We have, COPD is kind of linked to asthma. And then just you can look at the U.S. prevalence of chronic disease, and we'll begin to kind of solve an MSK module potentially. And so what I'll say is there are many entrants into the market. So what is Ochsner Health going to do differently in the digital health space? Well, we now think of us kind of as a digital health umbrella. We have chronic disease management, which I've shared with you today, but we also have front-end telemedicine that it really has been from an urgent care and a behavioral health or even specialist perspective in our community, but also beyond from a geographic standpoint, really seeking to provide more access to care, more touch points in a way that patients and consumers want and need, but also just out of necessity, whether through a pandemic or otherwise, for us to reach individuals. Our Innovation Ochsner team's doing some really incredible things as well, just to continue to innovate and really, again, set the pace for the future of digital health. Aging at home. So many of us have parents or siblings or others that we care for that maybe you can't quite be physically there as much as you used to, and they're autonomous enough to live at home, but wouldn't it be great if you had, sensors in the home to monitor, air quality if they're struggling with a respiratory illness and disease state. If a family member has fallen and they live alone, old school was used to wear something around your neck and press a button, but there's so many ways from a technology standpoint as well as just remote monitoring that we can plug in a very respectful way that still allows individuals to live their life independently, but with additional support. So there's some really great things coming our way.
Thank you. Good answers. Well, I think we are out of time. Thank you so much. Another round of applause for our panelists. All of them from today. So good. And thanks for having us. We appreciate it.
Well, I don't know about you, but I'm super inspired and so grateful to these amazing speakers we had today. I want to thank you all for being here once again. I want to recognize the board members that are in the audience and our chair of the board of the Hispanic Chamber, Ms. Marta Castillo. Thank you for your leadership. And please, we have calendars with our next signature events coming up. We hope you join us. Visit our website often so that you're in tune with what, and follow us on social media, of course, to know and learn about our events, the work of our foundation. We have the chairwoman for the Hispanic Chamber Foundation also in the room. Help us with our service to the community, and thank you all for your support. Have a great afternoon, and hopefully it stopped raining by now.